Hi.
Hi, how are you? I'm Jill. I'm one of the nurses here.
I'm Gabby. Nice to meet you.
Okay. So I just talked with the doctor, and he said he came in and briefly went over your results. So what did he kind of say?
So he just kind of told me that I have high cholesterol, and he briefly mentioned HDLs and LDLs, but I'm not really sure what that meant.
So he didn't explain that to you. Okay, so we'll go over it.
Okay.
So in your body, you have good cholesterol and you have bad cholesterol.
Okay.
Your good cholesterol is called HDLs. So that's where he got that from.
Right.
And then your bad cholesterol is called LDLs.
Okay. Also,
within the results, did he mention triglycerides?
Yes, he did say something about my triglycerides, but I also didn't know what that meant.
Okay, yeah. So triglycerides are another type of fat in your body. Yours were very high, so that's why we are putting you on a medication. Because the medication is going to help, bring down your bad levels, bring down those triglycerides, and increase your good cholesterol, so those HDLs that we talked about.
Okay.
Okay?
Yep.
Does that make more sense?
Yes, definitely.
So, do you have any insight on like what causes you to have high cholesterol?
No, and the doctor also didn't really explain anything.
That's fine. We'll go over it.
Okay.
So, an unhealthy diet, a diet high in fats, that'll increase your cholesterol. Excess weight, not exercising enough, and genetics. Does anybody in your family have high cholesterol?
My dad has high cholesterol, I believe, and it kind of makes sense now that you're thinking about it because I'm in college and I'm drowning in work and homework, and I really haven't had time to exercise, and I've been eating a lot of fast food just because it's quick and I haven't had time to make anything.
Right, yeah. So for other healthier food choices that would be an option is, a lot of fruits and vegetables. Even if you were to go to, say, one of the stores and just get one of the frozen freezer bags of vegetables, those are just as quick. Put them in the microwave, and in a few minutes they'll be done. And a lot of fruits, we said, lean protein, more fish. I don't know if you like those kinds of foods.
Yeah, I do like salmon. So
good.
I don't have a lot of the time to make it, but now that I know that I have this, I would definitely do my best to find some time to cook some good food.
Yes, and it's so important that we get you to be eating, healthier for your health, because if not, high cholesterol can lead to heart issues.
Okay.
So, I have a little diagram that I can show you to make this a little clearer for you. So, the bad cholesterol, so the LDLs, they build up something that we call plaque, and it's just basically a whole bunch of gunk in your arteries.
Okay.
So it makes the blood have a harder time traveling through, making it more prone to clots, and then all that bad stuff that can lead to further heart problems. And then this is right here on the left-hand side is a healthy artery, which there's no buildup of bad cholesterol, and the blood is freely flowing through, nice and happy, without a problem.
Okay. Well, thank you for that, because the doctor never mentioned that cholesterol and heart problems were even related, but now that you did tell me that, I am a little scared.
Yeah, that's understandable. It's a normal reaction to feel scared, but the team and I are here to support you and answer any questions that you may have. In addition, we did go over how it's manageable and that there's a bunch of lifestyle changes that you can make for yourself.
Okay.
Do you want to repeat back to me some of the lifestyle changes that we went over, just so that I can make sure that you understand?
Sure. So I am going to exercise more. There's a gym at school, so I would do my best to at least get to the gym once or twice a week, and to eat a healthier diet, lean protein, fruits and vegetables, avoid sugar, and avoid fast food.
Right, it'll be hard. Perfect. So the last thing I do want to ask you is, do you smoke?
I do not.
Okay, because smoking and high cholesterol is related, so I also wanted to make sure that you understood that in case you needed to, work on stop smoking, but that doesn't even apply to you, so that's fine. And the last thing that we're going to go over together is how this medication is going to work for you. So this is called Fenofibrate, or TriCor. And what it does is it decreases the liver's production of the triglycerides, which are those fats that we talked about.
Okay.
And it's going to decrease the bad cholesterol and help increase that good cholesterol. The bad cholesterol being those LDLs that we mentioned earlier, and the good cholesterol being the HDLs. Okay?
Great. Thank you.
But another nurse is going to be in to go over that medication more thoroughly with you and answer any further questions. Okay?
Okay,
but
thank
for
you.
me, do you have anything?
I do not. I think you answered a lot.
Good.
And yeah.
Okay. All right. It was nice to meet you.
Nice to meet you as well.
Bye. Hi.
Hi, my name is Gabby. I'm
Jill.
going to be another nurse working with you today. It's nice to meet you.
Nice to meet you.
So I know the other nurse before just talked a little bit about your cholesterol and how to manage it, but I'm going to talk to you a little bit about this drug that you're going to go home with. It's called TriCor, and I will give you some information also after to take home if you have any questions or if I don't answer them.
Great.
So some side effects that you may experience include stomach pain, diarrhea, constipation, nausea. These are normal, and it's okay if you do experience these. But there are some serious side effects that I want to make you aware of. They're not always as common, but I do want you to be able to look out for them, and if you do experience any of them, to call the doctor immediately, okay? So some of these side effects include if you feel like you're peeing any less, if you see that your pee is a darker color, and if you have any muscle aches or cramping or any muscle pain and you feel that you're more tired. I know this sounds scary, but I know, but they are not as common. They're serious side effects of the drug, but they are rare. So I don't want you to get too worked up about them, okay?
So if I feel these things, just call the doctor.
Yes, I want you to call the doctor immediately. They can just lead to a condition called rhabdomyolysis. We don't really need to get into that.
I've heard of that.
Okay, so you do know a little bit about what that is. Okay, so just call, but don't get too nervous because it is okay. Okay. Also, this medication can increase your risk for bleeding. So I want you to look out for any abnormal bruising that you may see, or if you see any bleeding in your stool. Okay. And also, if you notice that you start to get any yellow discoloration in your eyes, any yellowing of your skin, or you feel that you look more pale.
What would that be from?
That can indicate a liver issue, but again, it's a serious side effect, but it's not common.
Okay.
So I don't want you to worry.
Okay.
Okay?
Thank you.
You're welcome. So I also do want to talk to you just a little bit about how to take the medication. So I want you to take it the same time every day, but to take it with food. So you can take it in the morning with your breakfast, or you can take it at night with your dinner.
Okay.
Your choice, just make sure you do take it with food. It'll also help reduce that nausea that you may experience, okay? And I want to make sure that you do not crush the tablet, you do not chew the tablet, or you do not let it dissolve in your mouth.
So swallow whole.
Swallow whole, okay? And then I just want to make sure that you call the doctor or you notify the doctor if you plan to become pregnant or if you are pregnant.
Not a concern.
Okay, great. But in the event that, say you are on this in a couple years from now and you're planning to become pregnant, just let the doctor know.
Okay, definitely.
Okay? And the last thing about this medication is if you miss a dose, you don't want to double dose it. You can take it at your next scheduled dose. But if you feel that it's too close to the time of your next scheduled dose, then you don't take that one and you just take your normal dose as scheduled, okay?
Perfect.
Okay. Is there any questions before I give you this pamphlet?
No, thank you. I'm excited to have this. It's a lot of information.
I know, you're sweating. But this is just basically telling you all of the things that I just told you today, and it does give a little bit more detail about some of the more serious side effects.
Has all the safety information, so that's great.
And it shows you how to take it. But of course, you know that we are here. And if you have any questions at all, or even if you think that you're getting something, you just feel abnormal, where you don't feel like yourself, call us, give us a call, just ask us.
Absolutely.
And we will do everything we can to help make this process a little bit easier for you.
Thank you for your help.
You're
Thank
welcome.
you. It was nice to meet you.
Nice to meet you as well. I'm glad I can help.
Of course.
Have a great rest of your day.
Bye. Okay, so now we're going to go over some of the educational strategies that we use. So for my part, I used my beautiful diagram of the unhealthy artery, which has a buildup of plaque, and then the healthy artery, which is allowing the blood to just freely flow through. And I thought using this would just help the patient better understand and visually see like what actually goes on when you have the buildup from the LDLs in the bad artery. And then I also used Teach Back to just make sure that the patient understood what her and I went over and to make sure that she knows the necessary changes to be made. And that was, I think, really all I used in my part. But.
And then for my part, I just gave the patient this handy-dandy pamphlet or brochure, whatever you want to call it, just about the drug itself, and if she had any questions and she wanted to just refer back to something, or if she needed any information, a little bit more information or clarification on the medicine, that she had something to refer to when she got home. And yeah, that was basically my main educational strategy in my part.
Yeah, and then what we both did is we both asked like questions to make sure that the patient didn't have any further questions for us. So like, do you have any more questions? Is there anything further that we can go over with you, just to make sure that
the information was clear?
Yeah.
And yeah, so that's
it. So that was it. Thank you. Bye.